So let's now move into your office, let's say, and what would you say is one of the commonest things that people come to see you about? Is it acne, perhaps?
I see a lot of acne from young teenagers to people in their 40s or 50s, especially women in their 40s plus or minus are very prone to acne of their chin and jawline. We call that more hormonal acne, which is driven by estrogen, especially women that are not at menopause, but kind of getting closer and closer to that era of their lives, for some reason are more prone to those. And depending on where you are in life and what kind of skin you have, and all those other factors may determine what kind of treatment is ideal for you. There are treatments that we will use on those 40 or 50-year-old women who we would not use on teenagers. So there's a lot of different therapies out there. There's topical, there's oral, and now for the last 4 or 5 years or so, we've had a laser treatment for acne, which we never really had before. We had some light therapies, which came with a tremendous amount of downtime. But now we have lasers, 2 different lasers in the market here in the United States that are specific for the oil in your sebaceous glands. So it turns them into little, microscopic grenades, and it ends up killing the excess oil production. And so it can make dramatic differences, permanent differences, at least to the best of our knowledge, in acne, which is really, really useful for a lot of patients, especially because a lot of patients are hesitant to undergo kind of years and years of topical and oral therapy. And so I feel like a laser option is really valuable. We also have the gold standard, and it's always been and probably for now will remain the gold standard, which is isotretinoin, which is a medication that is essentially meant to completely shut off the excess oil production. So like I said, and I'm sure Vineet will build on this, there's many options for acne out there.
Absolutely. The top things I see in clinic are acne, hair loss,
Hair loss.
eczema, warts, you can probably say is up there too. Skin cancer. In the South Asian population, once I went to it was like a dinner party with my mom, my dad, about 15 years ago, and I was surrounded by all the aunties. And it was like a 2-hour grilling session on hair loss, nail problems, dry skin, pigmentary issue. And the truth is that I kind of enjoyed it because I was being helpful. It was a long night, but I think that the message that we do want to bring across is that there are actually good treatment options, safe treatment options for most of these conditions, and you can actually get good results that are very sustainable as well. Acne is a good example. Just the fact that we have a laser now for acne is huge. Accutane, you can do red light therapy and so forth. There's so many different ways to approach a problem that it's no longer that it has to be something systemic or something just topical. You can do like a multimodality approach, which actually yields to much better results. And I think the patients themselves can then kind of tailor things to whatever their liking is. And I think it's huge. Lasers has played a huge role for patients with rosacea. For hair loss, you have everything from the topicals to the orals to PRP. Now there's research being done on exosomes as well. And so there's a lot of opportunity, I think, here for patients that they have to realize that, it's not that they're stuck with that condition. I think sometimes people come in and they feel defeated. Like, for example, acne scarring. There are ways to treat, such as through microneedling, through lasers, through RF technology, and so forth, that can really help to improve the acne scars enough that they're not as self-conscious. Even if you improve the acne scars by 50 or 60%, not entirely, they don't have the shadow effect of the scars, and the patients feel a lot more self-confident. So there's a lot of things that we can do now that didn't exist even 5 or 10 years ago.
Yeah, I think like Vineet said, a lot of it comes back to quality of life. So things like severe acne and hair loss, uh, even when mild, can give significant quality of life issues. And like a lot of things in skin, the earlier you treat it and the more kind of rigorous you are about the treatment, the better the results are, and you can stave off scarring and other long-term issues.
And we also work very closely with our partners, such as in rheumatology, if someone has, let's say, psoriasis and has psoriatic arthritis as well, or our colleagues in immunology, for example, most of these medications that we prescribe for eczema, they're kind of developed by immunologists, really. Work very closely with pediatricians, kids who come in for molluscum, warts, whatever it may be, vascular lesions as well. Oncologists, people come in with skin cancer that may be metastatic or perhaps maybe more advanced. And so there's a big crossover in dermatology because it is the largest organ of the body. People may have oral issues like oral lichen planus, where we have to work with other doctors as well. And so it's actually an interesting crosstalk in dermatology because we do span such a wide field and we cover so much of the body as well.